over a period of time, this one question always comes to my mind. Some of the revenue cycle, stuff and billing and coding. The purpose behind starting your own medical practice.
And unfortunately, this is the story of our country, right? We have a lot of smart people. If they decide they want to fix it, it shouldn't take long for them to fix it.
How American healthcare system and how group like yours are they? What should be their individual goals to participate in the care of common citizens? I mean, there are groups who are billing for $100 injection bill. They're billing $1,500. Hello, 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 hello. How are you doing? Thank you, everybody. Thank you, everybody. I know this is an extremely, extremely wonderful time going on. Merry Christmas and happy holidays. I'm not going to take a lot of time today to introduce somebody whom I know for last 20 years since I entered into this country, wonderful country. He has been a wonderful friend to me, and he has accomplished a lot in healthcare, and especially when we talk about healthcare market in Florida. Before I'm going to introduce Dr. Saraiya, I'm going to give you a little bit background. For last 1 week, I have been reading about a book. Its name is An American Sickness. This book is written by Elizabeth Rosenhell. She has been a very, very well-known name in American healthcare. The book has been already become a New York Times bestseller. So if you are into healthcare or you are passionate about healthcare or some kind of innovation in healthcare, you don't want to miss that book. The book is available on Amazon, and you can find it to download as well as a hard copy there. So from that book, I'm going to read a paragraph so that we can set up a tone and set up a context behind which we are going to talk with Dr. Saraiya about healthcare systems. So the major complaint here is, and it's coming from everywhere, which is an employer-based insurance or people who are buying insurance from their own pockets. Everybody is complaining that the healthcare has become unaffordable. And if I take my example with a family of four, when we entered into this country 20 years ago, we used to pay Blue Cross Blue Shield about $100 per member per month, and everything was covered. Now, in last 20 years, our insurance cost has become 10 times more. Still, we have huge bills to be paid. So in this particular context, Elizabeth says the central mantra of innovation in the past decade has been patient-centered, evidence-based care. But isn't that the very essence of medicine? What other kind of medical care could there be? So with this, I'm going to introduce Dr. Saraiya. Dr. Saraiya, welcome to the show, and happy holidays and Merry Christmas to you. You all listen.
Thank you. Thank you, Kunal, and to all your guests who I can't see, but I take it that there are quite a few guests that you have online.
Yes,
So
even if they are online, we are going to have a recording of this show and people
wonderful.
watch. The best part of this show is it is broadcasted on LinkedIn and other social media channels.
Okay.
So our audience mainly consists healthcare entrepreneurs,
Okay.
physicians, even professors, and not only in United States but in India. And everybody wants to learn and talk about healthcare innovation. So, Dr.
Excellent.
Saraiya, it's a pleasure to have you on the show. I know you have accomplished a lot in the last 20 years. And when we talk about numbers, you just gave me some numbers that your group has over 350 providers, which includes about 200 doctors, over 100 nurses, and you are covering probably millions of patients at this moment in Florida. Is that right?
No, so uh, that's very generous of you. So Kunal, Florida Medical Clinic was founded in 1983, and we started small with a few group of doctors. Today we are about 250 or so physicians, 100 plus nurse practitioners, PA, and we are mainly covering the East Pasco County, also Central Hillsborough, as well as North Hillsborough. We probably service about 100 to 150,000 lives in this area.
At any point of time.
Yeah.
Fantastic. This is fantastic numbers. So we spoke about Elizabeth and his observation, and over a period of time, this one question always comes to my mind. And being into healthcare, not into the clinical side, but we have been managing some of the revenue cycle, stuff and billing and coding, and the purpose behind starting your own medical practice. Because when we talk to individual doctors, some new doctors come out of college and they have an aspiring dream to start their own medical practice. What was there in your mind so many years ago, when you started your group, and what was that dream? What actually you saw?
Um, Fear and leverage, right? So in the 80s, we all saw that, hey, all of us were doing well, but things were changing around us. In the healthcare, we saw a lot of changes occurring. Uh, and as a result, there was anxiety amongst physicians regarding what's the future, whether we will be even heard. And so we decided that like-minded people and majority of the docs that we started the group with, we were referring patients to each other. So there was already a pre-existing relationship, and we decided to formalize it in the formation in by forming a group so that we are operating within a single tax ID, and hopefully we have a better way to represent ourselves when it comes to talking to powers. Right? So that was the concept.
So how, when you started the negotiation conversation with them, what was the dilemma? Was there anybody? Was there any resistance?
We recognized that physicians are all independent, bodies, and they have a desire to continue to be independent, right? So it's very hard to try and have physicians tied to one group and have one leadership and one representation, right? So we had hired a consultant group to help us sort of create a dialogue between each other and together. And we spent an entire year actually looking at various aspects of what does the new picture look like, where are you today, what are the issues that we have, and we talk to each other in a very civil manner, all the issues, so that we can put everything on the table and try and deal with it. So yeah, it certainly was not an easy concept for any one of us. We were all very happy in what we were doing, right? And the consultants really were more interested in trying to see that there is a group here. Obviously, they had their reasons, right? As to why they are. But at the end, we also saw that there was it was a good opportunity for us to try and create a single entity and increase our leverage.
So we always talk about public policy, and that is my favorite subject. That any change or disruption, what happens, it's a direct result of some kind of public policy change. And this is a perfect example that you said that MSOs were coming up and people were getting nervous, having their own fee for service, and it is still happening. So what changed in last 20 years? I mean, how many years it's been, like 25, 30 years?
Yeah, yeah. So, yeah, we are, 30 years now going to be, soon,
Right.
for our practice, right? Uh, so, I mean, a lot of things have changed, right? I mean, we've been witnessing so many changes, right? And I think part of the issue that we have as to where we are, like Dr. Rosenthal in her book,
Right.
she talks about, I've not read the book, but I have
Yeah.
read some portions,
Yeah.
and I've heard her speak.
Right.
She's very eloquent, an internist. And, she says there are two things we can agree on as far as healthcare is concerned. Number one, healthcare is broken. And number two, in 10 years from now, it will be different. So that's all of us
Different
agree.
or difficult?
Pardon me?
Different or difficult?
Different. It'll
Different.
be different.
Okay.
It'll be different. It's changing, evolving constantly, right?
Correct.
So, and really, therefore, everybody has talked about the broken healthcare system and various components of it. I would say that Obama administration probably is the one administration that was successful in making some progress in taking an action.
Correct.
Clinton administration did sort of understand what needed to be done. They were not able to politically get it across, right? And our political challenges are part of the issue, right? We are divided as a country. We can't seem to agree on many things, right? Healthcare is also a very, very difficult topic nationally. As a result, the underlying system keeps growing at whatever pace it wants to, driven by all the various stakeholders that drive them, right? But the coherent national policy, still doesn't exist, and there is still a strong divide between the Republicans and the Democrats. Democrats were able to have some compromise and create the affordable care, and the intention was this is the phase one of it. We need to have phase two, phase three, and multiple till we get to a better system, right? So things that have changed is the payment system has become slightly different, and physicians are held, not just physicians, but all providers are held accountable for not only quality but also for cost, right? So that has started, and as a result, there is a different kind of dynamics, that you see in healthcare today. Uh, Again, the political will of the nation still doesn't exist for us to go to whatever we laid out. So, for example, Secretary of Health, when Seema Verma was there, she created what is called Pathways to Success,
Correct.
and Pathways to Success had an escalating sort of a risk for a lot of providers. There's a lot of pushback from providers, and there's lobbying, and now the political scenario is changing. As a result, things will change, and unfortunately this is the story of our country, right? We have a lot of smart people. If they decide they want to fix it, it shouldn't take long for them to fix it. Uh, but there is not a coherent policy, and no political will on the part of the powers to be.
And that is the reason she has been constantly telling that no matter what happens, whether it was Obamacare and after that Trump tried to, do something different or whatever has happened, it did not impact the way it should have been impacted. The cost is still a big concern. And now suddenly, when you see this Cures Act and you see the new affordable healthcare, and it is driving, even Medicare is driving towards quality side. Even with the No Surprise Billing Act, heavy bills to the patients, or non-network rates, people still feel that the cost is extremely, extremely high. So the cost is one part, quality is one part. Of course, we have to constantly fight because the whole thing is evolving, market is evolving, even the global standards are going, because now patients have choice. They can travel to UK, they can travel to Germany, they can travel to France, they can travel India, even for good quality health care. But question is how American healthcare system and how um, group like yours, are they, what should be their individual goals to participate in the care of common citizens so that they don't get the pinch of it. And that's where, because it's more on groups like Florida Medical Clinic, that not to bill a patient a non-network price if they don't have to. But that is not happening. I mean, there are groups who are billing for $100 injection bill, they're billing $1,500. For $500 x-ray, there are still bills going for $2,000. Where does this come from? I mean, how can we, I mean, is this common? Is this what you support, or what are your thoughts on this?
There's a lot in that question and in this comment, right?
Right.
Yeah. uh, you know so let's unpack things one at a
Right.
time, right?
Cost.
So what does a group like us have to do to try and survive and thrive? Let me focus on that question, right?
Okay.
So a group like us has to really recognize the fact that the healthcare system has changed, and we are no longer, a purely fee-for-service system. We have a modifier, which is we have to have accountability for performance,
Correct.
and that has to do with financial accountability as well as quality. And so we are all, need to be measured, and we need to have mechanisms so that we are constantly looking at what is the care we are providing, how costly it is, And are we doing good care coordination or not? What are our results? And what do we need to do to improve our quality, lower the cost? It's not an easy journey because there are many, many stakeholders, and every stakeholders have a different interest, right? And so frequently, this whole exercise appears to a lot of stakeholders that this is attack on their income, right? And so it becomes very challenging to manage that. So I'm not saying at Florida Medical Clinic we have succeeded in managing these challenges. I'm saying these challenges are identified and they are in front of us, and we have talk about it openly and say, here we are. Here is the graph of what our cost looks like. Here is where rest of the country is. Here is where our peers are, and what do we need to do now? In many of the things we are doing better than our group, sorry, than our peers, and so that's good to know, right? And it's good that we are able to achieve that, but we still have a lot to do. We still have a lot to do, right? And so that is, I would say that's what a group like us have to do, and probably other groups have to do something similar.
So, what do you think an ideal purpose when a brand new entrepreneur or physician entrepreneur comes out of college, he wants to start his practice? What advice do you normally give to them? Not with the, what you saw 20 years ago or what should be, but in today's scenario, what's an ideal situation? Should they just go and join a job, or they should definitely start something? What do you have to say?
Look, I'm not a guy who really is in a position to say I'll advise people, right?
Right.
That's not my forte, right?
But what's your thoughts on this
Yeah.
normal? I mean,
I mean, I,
normally,
w- I would say there are one or two principal items to keep in mind, right? What is your objective as an entrepreneur?
correct,
Is your objective to provide a decent healthcare, a very good healthcare? Uh, and what is the level of detail are you willing to go, right? So like sometimes you can have quality defined is just a window dressing, right?
correct,
And but you really need to have true better quality that can be felt by the consumers, right?
right,
And the very test of that is that they have choices available, they still choose you, right? And that helps in that situation. So I would say an entrepreneur, obviously they have desire to make a lot of money, etc. And I think we need to temper down the issue of money because it's already too complex, and I feel like more and more people coming in can
together,
create more complexity, right? So the basic level thing, which is the patient centeredness that we talked about, Dr. Rosenthal talks about, right? As in the patient centeredness is frequently being missed. Like, so sometimes organizations have mission statements, but they are in the books, they are not necessarily bought by everybody who are in the organization, right? And so question is, how do we make sure that we have one universal view you
right?
know for all of this, right? And so serving our community and trying to do such that we are going to be you know thorough in what we do. We're going to be transparent in what we do, right? And we provide the best care that we are able to do. Those would be the objectives to help create a good
Do
group.
you think a person can make enough money being a doctor in this profession? Because we get two very common feedback. One, they says, if I, like people who fall from groups like you, they come to us and we help them start their small medical practice. And they says that, we were making less money than we were with the group. Now we are making more money and we have more freedom. So that's a one common observation they have. Second, we have different second type of people who say, well, we may not be making more money, but we still have freedom to pick and choose the kind of care. So what do they mean by freedom? What is that something they feel they are not getting under the group or under the hospital and they are getting when they're solo or they are single? So that mindset we have to understand as a physician.
So I cannot speak for the docs who feel that way, right? But sometimes when you analyze the freedom that people talk about, how much freedom they have versus what they don't, what they do have, right? um, like, for majority of the time, they are working in a structural, way.
Correct.
And many of the decisions, or many of the things they have to do, they don't necessarily have, you know you know a lot of say. They have some say in the, like, they have say in the management of the
So you
patient.
mean the in a clinical aspect, or in an administrative
Well,
aspect more?
I mean the structural, right? So let's say you practice in a rural Florida,
Hmm.
I mean, so, and you have a certain things to do. You have only one hospital. So you got to go to the hospital and you got to follow the rules of the hospital, right? So that's something you don't have a lot of choice about. That's what I
For the
mean.
patient or for the doctor?
For the
Yeah.
care that your patient needs, right?
Okay.
You have a hospital and the hospital has the rules
Whatever
and
the resources hospital has, he has to use them.
correct. Correct. And so you have to make the most of it, right? And the way you manage, best care within it, that hopefully within the sphere of your working relationship, you have providers that have the kind of integrity, right? Uh, that you desire, and as a result, you have sort of a ability to have well coordinated care. So coordinated care is not easy. Coordinated care requires a lot of time, and when there are doctors who are seeing a lot of patients, on a day basis, they cannot provide coordinated care. And as a result, there are issues of handing over of care from one provider to the other, and then
Transition of care, you mean to say? Yeah.
complications occur, right? So many of these issues are already identified in the system, and people have, written, lots of articles about this. So I'm not saying anything new. For the purpose of discussion, these are some of the issues that you are going to deal with. You may be
Correct.
the smartest doctor, but then the specialists that you have too are the
Correct.
specialists that you have in town, right? You know, and so these are some of the things that,
So better transition of care. So if they are with the group has their own procedures, policy, operational workflow system. Is that
right.
what I'm
So
understanding right?
yeah, if you know that you have like-minded providers, right,
Correct.
and you want to have the ability to have uh, care, well coordinated care through the like-minded providers, and you are a part of the group, and you share the same electronic health record, which
Correct.
is what we have. We have the same
Correct.
electronic health record for all
Correct.
the doctors. Life become easier because the day your physician, your consultancy, the patient, the primary care doctor knows what happened. There is one chart for the patient, one
Correct.
electronic chart, health record, and so you have the ability to understand what is going on at that patient just by reading the chart, right?
Right.
And so there are things that you can do that can help, coordinate this.
So very simple question.
Yeah.
Compared to managed care versus fee for care, fee for service, or let's say ACO or whatever the new model, business models are coming up. And a lot of these business models are now financed or sponsored by private equity capital. Do you think it is a good signal for American healthcare for next 10 years when we are talking about that it is going to be different? And it has started already in like more than 50% earlier. So now, giving you an example, Florida Blue owns diagnostic clinic, hundreds of doctors. Common question comes to my mind as a patient: if I have Florida Blue and if I'm going to diagnostic clinic, my cost of healthcare should be low, but it is not the case. It is actually more. Same way, if I interview a doctor from diagnostic clinic, I have a lot of doctors. When I talk to them, they always complain, "Hey, we are not getting paid more. We are getting paid less. We have a lot of rules and restrictions on our head. We are not free." So then, who is happy in this new system?
Yeah. Great question. I don't know if I can answer that question, right? Is who's happy, so yeah,
So we
I mean,
always,
look,
when everybody is complaining.
it's very complex, right? I mean, you talked about managed care versus fee for service. In my personal opinion, fee for service system in the way it existed is pretty much going to phase out. Congress, the bipartisan budget committee had basically made some statements that there is a desire on their part to to gradually replace the traditional fee-for-service system with
Completely.
a system in which there is higher degree of accountability for all the providers, right? So
Correct.
that I think
That
is
we can
already
see it's coming gradually. Yes.
right, right. That's already occurring, right? I mean, the issues regarding consolidation that you talked about, that's going to keep occurring in the marketplace, right? Unless we as a country decide and have a political will, and we need to really have one voice regarding what to do. Today, what happens is the political differences between the parties are such that even if you have the best idea, the other party wants to, prevent you from making that successful for their own gains. And so I think there are some possible solutions. We certainly do need to have price control. I think there is a need for price control with pharmaceutical. I firmly believe that. I believe that capitation, is or population-based payment is a way to control the cost, at least initially. It may not be all the time, but at least initially, there is a need for us to have, capitation or a population-based payment to try and manage the cost. I think pharma, has gone too out of control, and that need to be controlled, right? So these are some of the things that the tools you have. I think we need to really have a greater focus on trying to create coordination of care, you know, uh, you know, at a patient level, and sometimes you see a lot of noise about that, and a lot of window dressing, and a lot of systems out there, but yet the physician involvement as a center of it is not quite there. Sometimes it is just offloaded to a team, and the team does what they need to do and then create a separate layer of work, right? So it's very complex in that regard, and I know I'm not maybe.
Well, you summarized it actually very well. I wish you all the best and thank you very much for coming on the show and giving your insights about it. This will help to most of our doctors. Thank you, Dr. Saraiya.
Thanks for the opportunity, and happy holidays. Merry Christmas to everyone.
Thank you.
Thank,
Thank you
thank
very
you.
much.